Hi, and welcome to InFocus. This is Jabbar Al-Obaidi. In this episode, we'll go back to the continent of Africa. We spoke about the call, what we call it, Global Africa Support, GAS. That's Global Africa Support. And we would like to bring the attention of the international community to the dire need of some of the countries in this important continent. So I know the coronavirus pandemic is really spreading fast and hard in some of the corners of the world. But I know also it's a fact that every country is focusing on its own people. But at the end of the day, we are one community, is it the international community, to also think about how we can be helpful to other nations. We have a journalist from Zambia. He is joining us through Zoom, and this is the new normal. So Justine Kawisha, thank you so much for joining us.
It's a pleasure joining you.
And so we were talking, off air that you are now at home or on your office.
Correct. Because of the pandemic that has continued to spread world over, Zambia has not been spared. And as a workforce, so we have been divided. We are not supposed to be crowded because that is going to put us at a risk of contracting and also transmitting coronavirus. So for those who are not scheduled to work on a particular day, they are supposed to work from their respective places. They are supposed to be home and only report when they are scheduled to do so. Like for me, I am not scheduled to work today, so I am doing my work, and I am only reporting on Friday when I'm going to be in the studio to do the programs and also news.
So you are still working, rotating all these humongous jobs, especially at this, I would call it emergency, because everybody needs to get the right information and the right time to the people. So the Zambia National Broadcasting Corporation, which is the ZNBC, is how big is the corporation there, and and how many reporters you have, and where are they? Are they just focus on the capital, or they go around and rural areas and suburb and all of that?
All right. I don't want to speak on behalf of the government or the broadcaster, but it is
no, in general, I'm talking in general, like because media today is very important in terms of providing information. That's what I am seeking.
You are right. It's a big organization which has a workforce of above 600, but all of them are not just dotted, are not just grouped into the capital city of Zambia, which is Lusaka. They are dotted across the provinces of the country, the 10 provinces of Zambia. And this workforce, all of them are not just reporters. They are a variety of professionals. Others are technicians who are able to make sure that pictures are of good quality, sound is of good quality. Others are reporters, others are producers, others are camera persons, others in the disciplines that will help us to work well, like human resource, others are in finance and accounts, marketing and sales. So all of them put together, they total to more than 600. And that is why it is very dangerous, like to bring everyone together, and hence the decision to just divide people to say, okay, in production, there are supposed to be 2 or 5 people that are supposed to be working. Instead, we'll just have 1 person who will be working today, while others will be working from their homes. And even those that are working in the studios, of course, preventive measures have been put in place. As you can see, I have got a mask that I'm supposed to put on. And even just the entry into the national broadcaster is restricted. People without masks are not allowed to enter into the premises of the national broadcaster. And even those that are entering, they are supposed to be their temperature is supposed to be measured so that they know to say, okay, what kind of the people that are coming in. And even those that are coming in, they are supposed to come in, of course, by appointments. If they are coming to accounts department, accounts is supposed to clear them with the security wing. If they are coming for production, there are doctors, there are media personnel that are coming to speak, to impart knowledge into the society. They are supposed to be cleared so that we do not just have an influx of people coming in and out without, because that is going to put at risk the people that are coming into work and the professionals that are being invited to come and help to explain some of the things that people are supposed to understand.
Absolutely, absolutely, because people, they look to the media and then they see how you guys do your job, and of course we appreciate that, and I hope this storm of virus will end up and we will win. So tell me, what is the situation there in terms of the spreading of the virus?
Actually, it was just 2 days ago when we clocked a month from the first case that was recorded in the country, and now we are saying we are a month and 2 days from the first case that was recorded. The country recorded 2 cases, and now, as of today, the Minister of Health was just giving an update. We have an accumulative number of 74, where we have got 3 people that have died, and we have 36 active cases. These are the people that are still admitted and are still receiving medical attention. Then we have got a total number of 35 recoveries. These are people that were admitted and they have tested negative repeatedly for a number of days before they are discharged to get back to their families. Today, the nation recorded a number of 4 cases, just 4 cases. Yesterday, the country recorded a number of five cases. So the country has continued to record cases, though the rate seems to be low, but the country is recording some cases and also discharges for those that are recovering from the disease COVID-19.
It sounds that you actually transitioning from preparedness to the actuality that you are doing it, because the cases started to appear. So in terms of the capacity there, hospitals and medical centers, and also the testing, because this is very important. Could you speak to that, please?
Let me start with the issue of testing. Yes, testing is going on, but currently the priority is only being given to people who are at a high risk, people who have been exposed. For example, like people who have traveled, because the country is still receiving visitors. They are coming in the country for various activities, for education, for businesses, and so on and so forth. So testing is being prioritized to the people that are coming into the country, and also the people that have been exposed, like people who are close to those who have tested positive. So these are the people that are currently being tested. But of course, the numbers are not so huge, because it's just until recently, I think about a few days ago, when we would get to above 200 number of people that have been tested countrywide, like those who have been exposed. Previously, it was less than 100 because the country would depend on the laboratory. We have no the mobile testing kits that could be used. So all the samples that would be gotten will have to be subjected to the PCR machine, where they would be thoroughly screened, and results will be announced by the relevant authorities, and in this case, the Minister of Health. Sometimes even the president has addressed the country twice to announce the results. So testing has not, like, the numbers have not, like, improved much. And this is a call that most of the stakeholders are saying. Now that we are recording cases from compounds, we have recorded cases where some people have been infected and they get sick, and they are only discovered when they are dead. And now it is a situation that most of the people are trying to call for mass testing, so that everyone can be tested, so that the actual numbers can be known. Because as it is now, we don't know the impact of the virus in our society, because we are just estimating according to the number of the few tests that have been done for the people that we think have been exposed. What about those other people? Because business is going on as usual.
That's right.
People are flocking to markets, people are flocking to town, except a few institutions that have been put to halt at the moment, like all educational institutions have been closed, churches have been closed, but some other activities are going on. So people are still exposed, like on transportation, buses are still moving. Although passengers have been advised to put on masks, passengers have been advised to sanitize themselves as they board on buses. But the fact is that people are still getting close to one another, which has the potential to transmit the virus from one person to the other. So the capacity is still a challenge. The capacity is still a challenge. Of course, we have seen a number of people that have come in, the number of stakeholders from the business community and families, other organizations that have come to the aid of the ministry or the aid of the government to make some donations in terms of material, in terms of testing kits, in terms of the ventilators, and so on and so forth. But I think talking about adequacy at the moment will not be right. Will not be right.
Yeah, this is universal. As you know, testing kits, the shortage of testing kit, and also of the ventilators that, as you mentioned. I mean, we see what's happening now in Italy and Spain, and United Kingdom and France, and here at home in the United States. Now, as you know, the United States, at least for now, decided to withhold its financial share with the WHO, World Health Organization. Any reactions from you as media people, and also from the government, or the general public about that?
As a citizen of Africa, I am aware that our health system has been dependent on support from various stakeholders, including the World Health Organization. I may not actually mention the figures as to the exact amount of percentage that the ministries are depending on, but it is a fact that our health systems are depending on institutions, major institutions like the World Health Organization. And hearing pronouncements of the suspension of funding from countries like the United States of America is something of very serious concern, because this means that the help that has been coming through from the World Health Organization is definitely and drastically going to reduce, and that has a lot of impact on the lives of people in Africa. Of course, there are very few people who can afford to pay for medical facilities, medical services, and they depend on the government to provide the free medical care. And so the government does what it can to help and help its citizens. But of course, on its own, does not manage and also depends on well wishers, depends on organizations like World Health Organization. And so this news is not good news for Africa because definitely it is going to have a lot of impact because the country or Africa is getting help from World Health Organization in terms of fighting HIV/AIDS, in terms of fighting malaria, in terms of the other vaccines that are being introduced into the country, even in terms of the medical, the medicines that the continent is receiving. Much of it is coming from World Health Organization. Not only that, in terms of capacity building, in terms of technology in the health sector, all that the World Health Organization is playing a pivotal role to making sure that Africa does not remain behind. Because just as you are saying that United States of America has an advanced medical care, medical system, but look at what is happening in the fight of COVID-19. It is a challenge. Now imagine those numbers that are being recorded in USA, in Italy, in Spain, in France, in UK. Those numbers are replicated in Africa. Africa is going to be wiped out. Africa is going to go because all these issues are very, even just finding ventilators, I don't know, maybe it will be a challenge. So the news of World Health Organization reducing or having a suspension of some funding is not good news at all. And this news will have a lot of impact. Actually, it is a direct hit on Africa. Direct hit
No,
on Africa.
I read some of the news from the regional office of the WHO in Africa, and exactly it's an agreement with what you have said. Now, I'm just for like public education because this is really needs not just the politicians on front, but this is and the media, of course, is as we said is very important, but also public education. So I'm curious how much of media coverage in Africa, in your opinion, the decision of this financial cut to on the aid to WHO has generated in the continent?
I think to be honest, I personally haven't heard much of the coverage of the suspension of funding. It's like the issue of COVID-19 has overwhelmed all media houses. Like here in Zambia, each morning, each media institution will be waiting to hearing what the Ministry of Health is going to say, the number of people that have succumbed, the number of people that have contracted, the measures that have been put in place. But really talking about the suspension of funding, I think very little has been done. Probably people are trying to underestimate the effects of the suspension of funding and are just going to react when reality dawns. That is when they are going to realize to say, oh, okay, so this is the meaning of the suspension. But as at now, I think very few has been said and very few has been done. Probably now we need to stand up and start to talk about it so that people can be aware about the impact of what is to happen, what is to come. Probably only then now, even the pressure groups, stakeholders, and so on will start to talk about it. Because as at now, I think nothing much has been said regarding that, especially here in Zambia.
Yeah. So now, tell me about the role of other civic organization like NGOs, how they, what's their role there, and how they can work, hand in hand with the government and other organization. because this is not kind of specific to a group of people. This is nationwide and now global wide. So I wonder if these NGOs and other organizations that they are doing something that will help also and enhance the whatever capacities are there for the hospitals and for first responders, and how is this works there?
I'm smiling because you've just reminded me of something. You as a professor, you know, there's something we call agenda setting in media. Probably it is time that we, the media practitioners, should set the agenda and start following up all these organizations and tell them to say, hey, this is what is happening, and start for them to start talking, for them to start mounting pressure and so on. Yes, non-governmental organizations have a lot of roles, and one of the roles they play is to advocate. Another role that they play is to support. Actually, right now, these are the groups that we are supposed to see to stand up and start talking, because government may not say much because of its own interests. Probably now we are talking about the United States of America, and if the government will stand and say much, there may be repercussions. They may say, okay, we may jeopardize the relationship between the two countries. And so the role that NGOs are supposed to play is like now advocating, now getting down to remote areas, bring out what is happening and show the world to say worse is going to happen. If this is happening right now, then when we are getting help from WHO, now what is going to happen if WHO's hands are going to be tied in terms of giving assistance, rendering help from countries that have got challenges with their healthcare systems. So I think NGOs have a mandate to speak, because with them they have no boundaries. They have no boundaries. They will not say we are going to jeopardize our relationship with the government. They are not in government, so they can speak, and they can speak out and mount pressure up to that time when they'll say, okay, we have done our work. And I think we are supposed to remind them, we are supposed to wake them up and ask them to say, what are you going to do? What do you have to say about this, so that
Well,
everyone can have a say?
yeah, you're right. So what are the critical in your estimation, critical needs in Africa in general, in your country in particular?
Africa has a lot of needs in terms of medical care, and these needs are wide. They are ranging from infrastructure, like in Zambia, you find the health centers are dotted all over the country, but there are some places where people need to walk long and long distances to access basic medical care. And one of the things is that is of paramount importance, the stocks of drugs, the stocks of drugs. Because if you have got people who are HIV positive and are on ART, and you start experiencing shortages of drugs, then you can see that that is going to be a serious danger to members of the society who are on ART. There are also a number of diseases and medical complications where people have been put on medication, and they will need constant monitoring. They will need drugs all the time, and usually this is a challenge, because there are some times when you can go to a medical facility and the medical practitioner will give you a prescription to say you are supposed to go to a drug store, a chemistry. You're supposed to go and buy the drugs. And we in urban areas are privileged because, of course, you may have a few little resources and drug stores around where you can walk to go and buy the drugs. But now the people in remote areas. My parents are in remotest areas of this country, about 1,000 of kilometers from here where I am. And just for them to get to an area where they can access some basic drugs to buy, to find a drugstore, they have to move 120 kilometers for them to go and buy a Panadol or any other drug. So there are a number of essential things that are required in our medical system. But I think it starts from infrastructure. It also goes to issues to do with medicine and even manpower itself. You find a health center is being manned by two people, and there are cases, and that is an area of the population of more than 300,000 people. And there are people who are coming at night during daytime, and these people are working without looking at time and so on and so forth. So there are a number of things that our medical systems would require.
Justin, you mentioned something about the school. So schools and academic universities, are they closed now, or they transitioned to the online education?
Actually, last month, schools were closed.
In March?
Yes, schools were closed before the country recorded cases of COVID-19. But no sooner had the schools closed than we recorded the first cases the following day after the closure of schools. But government has realized that this is going to be a challenge for pupils to catch up, because days are moving, syllabuses have to be completed, and so on and so forth. So that is why now the issue of e-learning has been introduced. The Ministry of Education, the Ministry of General Education, and Ministry of Higher Education are using my institution, the national broadcaster, to broadcast lessons for primary education, lessons for secondary education, and also lessons for tertiary education. But much of some courses, like for tertiary education, are being done online. Right now in the office where I am, I've got a colleague of mine who is looking at me. He's in school and he's studying online, he's doing his assignments and so on and so forth. Actually, technology now has to come to the aid of the world to help us, so that at least in one little way, life could go on in terms of education and a few other things, including business. Some people would buy some things online and then would book for such things to be delivered to their places, just to avoid the issue of them stepping out of their homes and then to get to public places where they can be exposed.
So Justin, do you have a message to the international community in terms of global Africa support?
Yes, I have an appeal, and I have a passionate appeal that Africa needs help. And this is real. This is not a joke. I am a journalist, and I move in Zambia and other neighboring countries. Getting to rural areas, it is sad to see what people are going through. And Africa just needs help. Zambia needs help. We need help. And if this help halts, it is going to be a challenge that will be very difficult to fight, to win. It is going to be a battle that is going to be. We have had challenges like epidemics. We have had cholera cases, and you can see how you will have to struggle for you to win that fight. But now, to the global community, I think don't turn your backs on Africa. Africa needs your support. Africa needs your help, because if not, Africa is going to be wiped out.
Justine Kawisha is a journalist and reporter for Zambia National Broadcasting Corporation. Thank you so much, and thank you for watching In Focus, and we'll see you next week, and have a good day.